My name's Oshani Dissanayake. I'm doing the Executive MBA in Health here at UCL's Business School. And I am a doctor by background, so I'm a registrar in infectious diseases and microbiology. I've had a 10-year career and I've been very patient-facing, so that's given me a great background to patient care and understanding the delivery end of the healthcare system very well. But I had a huge gap in my knowledge of how healthcare systems work, how the business side of things run. And I often find that doctors don't really speak the same language as policymakers and the governments that set the healthcare agenda. So I wanted to try and bridge that gap and really understand the healthcare system and the healthcare ecosystem as a whole. So I think there's been a few aspects of the course that I've really loved that I think really make it unique. So the real world case studies alongside the modules that we've done, so things like strategy, marketing, organisational behaviour. We used a lot of case studies in medtech that really help ground our learning. And this module that we've just finished has been economics and finance, and we had this wonderful real world simulation. So we were all pitted up against each other in groups of 4, and we became the execs of a hospital, and we had to do all the financial planning, the capacity building for the hospital. So we learnt a lot of the things that we'd learnt in theory. We got to apply in a competitive environment, which was fantastic. I'm currently on the first of the residential weeks for the course, and that's been a great experience to really learn from my colleagues. We're such a diverse mix of people on the course, some people with 20, 30 years of work experience, so everyone brings a lot. So really the camaraderie and the things that you can learn from colleagues is great on this course as well. What really stood out for me was it has quite a unique perspective on health. So there's lots of different MBA programs around, there's lots of different exec MBA programs, but no one that really offers a view on healthcare systems on a global perspective like this course. So for me, it really bridged the gap between clinical practice and the healthcare systems globally. So it was a standout. So I would absolutely recommend the Exec MBA in Healthcare for anybody engaged in the healthcare system directly or wanting to be engaged in the healthcare system, because it offers such a unique experience compared to other MBAs. I'm so looking forward to the next year ahead, and I'm already sad that it's going to be over. So I think this MBA offers so much that some others don't, because it offers such a unique perspective.